morning, Get Fit family. We're back with another episode of the Get Fit Wellness Challenge podcast. I've got my new guest here today. It's Dr. David Kuhlmann with Bothwell Hospital here. He is a sleep specialist. So today's topic, gang, we're going to talk a little bit about sleep, how that is important to overall health, some of the implications of a bad sleep habit, and how sleep can really not only affect your mood and your energy levels throughout the day, but really what are some of the underlying effects that it can really cause over a long-term period of time. I know I've always struggled with sleep. It's something that's in my family. I am 40 years old now, and it's I'm at that age, doctor, that I really have to start taking care of myself and look at some of the deeper issues that I've just kind of been pushing back over all these years. But again, welcome to the Get Fit podcast. I appreciate you coming. We're down here at 1200 East 12th Street, or excuse me, 600 East 12th Street, in Dr. Kuhlmann's office here. And so, doctor, tell me a little bit about yourself, sir.
Well, I came here out of my sleep fellowship I graduated from the University of Michigan and did my sleep fellowship there. I did neurology residency at Indiana, and I'm a Kansas fan. Went to Kansas University Medical School, so don't hold that against me.
So you're KU?
I am KU,
right.
but don't hold it against me. But I've been here for 15 years now. My first job out of my training.
So, was right back to here, okay.
Kansas City. I'm from Kansas City, but I fell in love with this job in the city.
Yep. Why did you, when you were going through school, what made you want to do the sleep stuff, the sleep aspect of it?
Well, I was in medical school trying to figure out what I wanted to do, which specialty, and I was never a big medication person. I was more interested in preventative medicine.
Okay.
And I back in the late 1990s, sleep was still pretty much in its infancy, and so discovering sleep medicine at that time, it made me realize, there's better answers than always, prescribing medications, which can be very helpful. Certainly I'd want to have a medication if I had a bacterial infection, but I'm not a big fan of symptomatic medications, like taking Xanax to help with anxiety. That's only going to help you temporarily, and there's always side effects and other issues. So I thought, well, sleep is something, if you get people sleeping better, that can really help with their overall health.
It absolutely can, and that was one of the ideas here with the podcast, is kind of talk a little bit more about how do we prevent things from happening, or how do we actually fix the problem. We've talked a little bit about chiropractic. We talked a little bit about the mental health side of things and the benefits of running and exercising. So I think sleep really is more important than a person really thinks.
It is, and one of my sayings is people who wake up early to exercise are stealing from Peter to pay Paul, because we kind of need both. I mean, certainly exercising is great. I try to do that as much as I can, but if you're, there's been studies showing that if you're not getting enough sleep, people's like, I don't understand. I have a lot of my patients like this actually. It's like, I'm eating as well as I always do, but yet I'm gaining weight. Why is that? And when they come to talk to me, I explain to them, it's like, well, if you're not getting enough sleep on a nightly basis, there's studies showing you have increased production of ghrelin. It's a peptide secreted by your stomach, makes you feel hungry.
Okay.
Decreased sensitivity to leptin. It's protein secreted by or peptide secreted by your pancreas, makes you feel full. So you have these signals in your body telling you essentially you're not hungry to eat more. Your willpower's down. You're craving simple carbs. You're tired. You're not wanting to exercise. So it's something that it's part of the overall picture of your health. And if you are, we can talk about this a little bit more later, but if you are going to be trying to lose weight, trying to get fit, good sleep is a huge integral component of that.
So I've heard a lot of different things. I sometimes I watch these motivational videos and I see these exercise people say, Arnold Schwarzenegger, I think, said he only used to get 4 hours of sleep. Some of the Navy SEALs, when they're doing their training, sometimes they go days without sleeping. How much sleep should a person actually get in? That's probably an open-ended question, because there's different kinds of sleep, isn't there?
Yeah, there's different kinds of sleep. It's been a badge of honor, like for example in the medical profession, it's like, I get by on so much sleep, and one person who was really prided himself on the lack of sleep that he got was Benjamin Franklin. Of course, you don't want to have a body like Benjamin Franklin. So I'd say the low end, certain people only need 6 hours, and some people need a little bit more, like 9 or 10 hours, but most people are in that 7 to 8 hour sweet spot. And if they're trying to get by on a lot less than that, there's going to be short and long-term ramifications of it. In fact, the recent study showed, for weightlifters, trying to wake up early to exercise, showed that there's an 18% reduction in protein synthesis More catabolic. Catabolic means muscle loss.
Yeah, absolutely. So instead of burning fat, you're burning muscle. Yeah.
So you're not doing what you were hoping to be doing by not getting enough sleep. Not to mention just the fact that your mood may not be as good, just not being your best self. And other studies have shown that you gain 300 calories per day on average if you are, because you're eating 300 calories more per day if you're not sleep depriving yourself versus if you're not. Of course, I'm sure that varies based on how much sleep deprivation, but it's a huge part of it. The clinical picture, of course. One thing, you mentioned different kinds of sleep that we have. There are different kinds of sleep, and that's part of the reason why it's so important to be evaluated if you think you might have a sleep disorder, because people who have sleep disorders tend to have more of the less refreshing, less restorative sleep, like stage 1, stage 2, versus the slow wave and REM sleep that you have. If you have good quality sleep. REM sleep is good for mood, it's good for memory, it's good for sexual function. Slow wave sleep is a big part of the overall regulation of your muscle and body.
So when you're supposed to sleep your 7 to 8 hours, just talking about the average person, that doesn't, not all of it has to be in that REM or that REM.
No, REM sleep only typically makes up about a quarter of your sleep.
Okay.
Yeah. Okay. But a lot of people with sleep disorders, they don't. It's one thing. So you shouldn't necessarily remember all the content of your dreams, but you should wake up in the morning and say, "Yeah, I dreamt last night." And if you don't remember a lot of people say, "I dreamt as a kid, but I don't seem to dream anymore," and that can be a sign of a sleep disorder.
That is interesting. I've never heard that before, because there's sometimes I feel that I have great sleep, and when I do have great sleep, I have great dreams, and sometimes they don't make any sense and they're crazy. But then sometimes most of the time I don't think I can remember that I dreamt or anything.
Right. The way I describe your body isn't want to do anything that's bad for it. Same reason I don't want to take my head and bang it against this chair right here. It's the same reason why a lot of people don't go into REM sleep. Because, what happens, so one thing that is incredibly common, especially get older, you mentioned you just turned 40, is obstructive sleep apnea. Normally, you have good muscle tone of our throat. These muscles help us to talk and to breathe. But at night, when you're sleeping, these muscles, they can partially or completely collapse. And just like a river that narrows, that's where you hear rapids in a river. Same thing is true with your airway and snoring. And without knowing it, a lot of people can stop breathing completely. And this can happen, hundreds of times per night for 10 seconds or more. And so the reason I bring up REM sleep is during REM sleep, all the muscles of our body are essentially paralyzed or inhibited so that we don't act out our dreams. But that includes muscles of respiration, these muscles in our airway. So what the body does is, rather than enter into the stage of REM sleep, dream sleep, where it knows it's going to decompensate, desaturate, it avoids that stage of sleep entirely. So that's why in obstructive sleep apnea, patients have a lot more problems with impotence.
Okay.
You might find that if you treat sleep apnea, that you get better control of that as well.
Very good.
I get a lot of referrals from urologists.
Okay. Well, that does make absolute sense. So when you're talking about when we go, when our throat muscles, start loosening up, and that's when the snoring starts, essentially.
Correct.
Is that right?
Yeah.
Well, I've been a snorer my whole life. Even since I was about 10 years old, I started snoring.
Sure.
And so is that kind of the first sign if I'm thinking that I'm having some sleep troubles and I want, is snoring essentially the...
Snoring is certainly very common in patients who have obstructive sleep apnea, and you can have just primary snoring, which essentially you don't have sleep apnea, you're snoring. Certainly kids with enlarged tonsils can have snoring. People with deviated septums, if you drink too much alcohol, that also loosens those throat muscles. So there's a lot of other things besides just sleep apnea that can cause the snoring. But yeah, that is certainly a primary thing. Other signs of sleep apnea, nocturia, which is another reason I get frequent referrals to urologists, that's going to the bathroom more than 3 times per night.
Okay.
Episodes where you stop breathing or waking up in a panic, that's something that a lot of patients don't recognize that they're doing. Unrefreshing sleep, morning headaches, daytime sleepiness. So it's one of those, and one of these things, if being sleepy was painful, my sleep clinic would be even more filled than it is. But people are like, it's just sleepiness. But they don't realize the long-term ramifications can impact decision making. It can impact safety awareness. So it's one of those things that you just got to get the motivation to come in and go in and seek treatment. And you might find that you can get to feeling a lot better for a 40-year-old than you actually are. When I say, here's a 40-year-old perfect health, here's you. with potentially an untreated sleep disorder. It's a lot easier at age 40 than it is 50, 60, 70 to get back on that road to good health.
So what are the steps we do? So let's say because that's why I was very interested in this one here, is because I do feel that I've always kind of had sleep issues. It's just referring to last night. I live a pretty busy life, and I've always been a really early riser, and it's just the way for some reason my body wants to wake itself up at 4:30 in the morning, and I've kind of trained it that way. But last night I didn't get to bed till after 10 o'clock, and finally fell asleep about 11 and woke up at 4:30. But throughout the night I probably woke up 2 or 3 different times. When would somebody think it's time to get come in and see you and get a sleep study, and how does that process look like?
First of all, I never get on somebody who has a sleep disorder for not getting regular sleep or not keeping a regular bedtime, because if you can't sleep 8 hours, or if you don't feel any better sleeping 8 hours, then you'll have a whole lot of incentive to sleep 8 hours. Once you treat your sleep disorder, then I will encourage people to keep a more regular bedtime to get the full 8 hours of sleep. Talked about morning awakening, and for me, when it comes to obstructive sleep apnea, people have problems falling asleep. There's a wide differential in things that can do that. Whether it be restless legs or primary insomnia, or just pretty much a lot of different things can cause people to have problems falling asleep. People have problems staying asleep. People say, "Doc, I fall right to sleep, but then I wake up a couple of hours later." That, in my clinical experience, is most often obstructive sleep apnea.
Okay. Yep.
So what's the process look like for getting evaluated? I have clinics here. I have clinic in Warsaw. I have clinic in Marshall. Primarily I'm here, but I like to travel because I like to be able to be available for patients. And not everybody can drive to Sedalia in this surrounding area. So those are my 3 locations. And they'll come in and I'll evaluate them. There's 2 different options for testing. The in-lab testing is more for patients who are more complicated sleep disorders, or have a lot of comorbidities like COPD, which is breathing disorder, or heart disease. They may require in-center testing. But for a lot of patients like between the ages of 18 and 65, a home sleep apnea test is what we would perform.
Okay.
And they'd come into the center, and it's just bands around their chest and their abdomen, oximeter on their finger, kind of a probe under their nose looking at their breathing, and a lead on their leg. They'd be instructed on how to set themselves up here at the sleep center.
So how do those machines tell if the person's actually sleeping and how they wake up and things like that?
So they don't really, because they don't have EEG, which is a way that measures brain waves, they don't actually tell patients or tell me that they're sleeping. It's more recording time, which is one reason why they tend to underestimate obstructive sleep apnea. And that's why they would come in for in-lab testing, because then there's a kind of discrepancy in what we think might be happening versus what the test shows, because this test tends to underestimate sleep apnea. The only other problem with the home sleep apnea test is that artifact and may have to repeat the test because it's not a diagnostic test.
So after they do the sleep study test, they come in. The one I hear the most about is sleep apnea. Are there other things other than sleep apnea that people can get diagnosed with?
Yeah, well, home sleep apnea test, obviously sleep apnea only diagnoses sleep apnea, but yes, there's many other sleep disorders. We deal with quite a bit of narcolepsy with younger patients, and that's just patients who, you think of more like sleep attacks, and those are, that's certainly part of narcolepsy, but really it's more, there's a lot of other symptoms like cataplexy. That's where they get weak with strong emotion. They can have hypnagogic hallucinations where they see things before going to bed, and then they also can have sleep paralysis where it's a scary feeling when they wake up and aren't unable to move. And they can happen in patients with a history of head trauma, with loss of consciousness, and people who have a history of mono. It's pretty more rare to sleep disorder, but I certainly see quite a bit of that as well. Of course, insomnia I always deal with. Restless legs is a very common sleep disorder. People mistake that for periodic limb disorder, which is another disorder where they tend to have a lot of movements during that, like kicking, that can be bothersome to the bed partner, not associated with sleep apnea. And then one thing that's more concerning is something called REM sleep behavior disorder. I mentioned previously how we tend to be essentially paralyzed during REM sleep. Well, people with REM sleep behavior disorder, they're not paralyzed, and so they're acting out their dreams. Okay. And this is associated with a lot of neurologic diseases and memory disorders.
So is that what happens when people do their sleepwalking, sleepwalking?
That's a wonderful question. Actually, no. Somnambulism is more associated with slow wave sleep, and it's It's not necessarily sleepwalking per se. I think if you had an EEG on, you might find that they're actually awake. It's more they don't remember what they're doing, and they wake up. It's like, no, I didn't. It's like, here's your video showing you were getting into the refrigerator.
Yeah, exactly. Yeah,
it's like they don't have any recollection. It's because sleep eating is actually pretty associated with sleepwalking as well. Stress, calorie restricting yourself too much in the day, can cause some sleep eating and some sleep disorders and medications.
Absolutely. So you talked about the some of the medications. So what are some of the things that you can do to help? Now I know we'll talk a little bit about the CPAP machine that a lot of people have heard about. But if it's not sleep apnea, what are some of the things treatment plans that?
Well, fortunately, I'm not a big medication person, but we do have some good medications that are pretty well tolerated for people who have severe daytime sleepiness. We used to be stimulants, which are good because you feel great. They're called, they help with your alert. You feel great, but then there's a crash associated with them. And then you have sleepiness worse than before, and there's a component of addiction, but there's wake-promoting agents, and there used to be just Provigil and Nuvigil, the difference is that wake-promoting agents, you don't necessarily feel more alert, but you don't feel like you're going to fall asleep, and they work for about a day, and they don't have as much side effects. I mean, all medications have side effects.
Absolutely.
Some people can't take some of those, but we have several now. We used to have Provigil and Nuvigil, now we have Wakix and Sunosi as well. So there's several options for patients who have daytime sleepiness, whether it be idiopathic hypersomnolence. What that means is idiopathic means we don't know what's causing the sleepiness, or narcolepsy, or even hypersomnia associated with some other sleep disorder. So.
Okay, very good.
And then CPAP, though, for sleep apnea, that's the primary thing that I deal with. And what I describe to my patients is try to sell them into what if I said that I had something for you that may help you to feel better, potentially live longer, and doesn't really have any side effects. Side effects of CPAP can be bloating, mask marks on your face, dry mouth, but compared to the benefits gained, it can be pretty substantial.
And my father, he has a CPAP machine, and he's been a loud snorer, and a lot of that's inherited, but he refuses some. I don't know if it's just because he just doesn't want to, but the technology anymore of these CPAP machines make it a lot easier for people to wear and to sleep with on a regular basis.
That is true, actually. The machines have gotten better algorithms. I mean, it's just room air. It's pressurized room air. It's pushing air into your airway. So that can't be changed too much. But the algorithms have gotten better on the machines. The humidifiers have gotten better. And then most importantly, the masks have gotten better. And the way I describe it, the three things that you need to wear CPAP. Okay. You need to have the desire. You need to have the right mask. Okay. And you have the right pressure. And if you have those three things, I think that you can get to working on it. And you might notice a substantial improvement. When I was 10 years old, I wanted to be in Major League Baseball.
Well, so did I. Well,
the problems is I couldn't hit and I couldn't catch. So I guess I'm not good at baseball. But then I got my glasses in about that time. I'm like, oh my gosh, this is what it's like to see normally. And same thing's true with patients and their sleep. They assume sleep is normal for a 40-year-old. Then they get their on CPAP like, oh my gosh, I wish I had done this years ago, because they realize that you don't necessarily have to have such bad sleep as you get older. It can be something that you can still sleep like you were in your 20s again.
Very good, very good. And that's what I want people to know, is that there's, what you mentioned, you didn't know what it was like to see right until you got glasses. And I'm the same way. I would like to know, what it's like to, what real good sleep is like and what it's supposed to be. So let's talk about, we kind of mentioned a little bit at the start of the podcast, though, about bad sleep and weight gain and the inability to lose weight. Let's dig down a little bit deeper into that. And what in part of your body does that make it reason why you gain weight? Or
and I kind of mentioned, of course, all those hormones that are being secreted by your body that basically are working against you, and then the willpower and craving simple carbs. It's something that if you don't. So when I got on CPAP, my oxygenation, I feel like, I assume it's my oxygenation, but I was a marathon runner. And I found that I was running better because I was sleeping better at night, both because I was sleeping, had more energy, but I also felt like, I didn't understand, but I felt like I was breathing better during the day, even though I was using that CPAP machine at night. And that's, speculation on my part as far as the cause. But I just think you'll just find that as far as weight gain, weight loss, and just making better choices. Because if you're sleeping well, if you're operating, the way that you should be, you're the person that your mood is better, your decision making is better. You don't do the reward eating. I think when you're sleeping poorly, your food choices, like what tastes good to you, is very different. More sugary and fatty food versus not. So isn't just one thing as far as sleep and weight gain, or their association, but there's on multiple levels. Decision making, food choices, internal, the optimization of your body processes, etc. So multiple things.
Absolutely, absolutely. All right, well, Doc, I appreciate you giving us some time today. Now, if I'm a Get Fit listener out here and I have some questions about my sleeping habits, or I'm concerned about some things going on, how do they get a hold of you in your clinic?
Well, we have a centralized scheduling line, and 827-9573.
Okay.
They can call that and get scheduled for an appointment. Does not need a doctor's referral for that, but be happy to to go through your doctor for that. And come talk to me.
Well, very good, very good. So what I'll do, gang two, I told you earlier in this podcast that I am going to call that number. I'm going to get registered to do a sleep study because I do find that I feel that I have some issues sleeping, and so I'd like to get that taken care of. We'll do that. We'll come back and Dr. Kuhlmann and I will go ahead and kind of talk about what the results and what the next steps are going to be. But if you have questions, guys, in the link below here on our YouTube channel, go ahead and ask a question that I can refer to Dr. Kuhlmann here, and we don't be afraid to reach out and ask for help. So, Dr. Kuhlmann, I appreciate your time today. I'll let you go. I know he said he's heading down to Warsaw this morning.
That is correct, and I'd love to have another one of these for a follow-up to see how you're doing if you end up coming in.
Absolutely, absolutely. So, Get Fit Gang, signing off here. But again, I am challenging you to get fit.